Scientists have tried to conquer the mind through many different ways for many different reasons. One such is in the treatment of mental disorders. Experimental science has, in some of its most controversial studies, shed a light into how the brain works. We have seen this in this very series with the monkey mother, baby Albert, and Milgram experiments. But how about the treatment of mental disorders in a world before modern-day medicinal drug-based therapy? Around the mid-20th century, a form of invasive surgical procedure would gain praise for being able to tackle the problem of overcrowded mental hospitals and treat the previously untreatable. It would eventually be known as the lobotomy. The surgery would go down in the annals of time as a barbaric and cruel procedure, which would leave behind thousands of patients in its wake with devastating side effects including confusion, incontinence, seizures, and in some cases even death. One of the main characters in the story of this surgical procedure would describe the operation as surgically induced childhood. Eventually, the surgery would become synonymous with the mishandling of mental health and the running roughshod over patients' rights. As such, I'm going to rate this dark page in scientific history a 9 on my plain difficult ethical scale. Welcome to the dark side of science. It is the turn of the 20th century. Mental health institutions throughout Europe and the USA have become dangerously overcrowded. During the 19th century, where scientific discovery took leaps and bounds, many attempts to treat the mentally ill had failed, leading to a large population of incurable patients. This was due to many industrialised countries having national systems of regulated asylums. These institutions sought out care for patients that had been disposed of in the system by their families, poor houses, and the criminal justice system. With no proper ways of treating inhabitants of the asylums, many different forms of medical procedure were tested on the unfortunate patients. There are many gruesome types of treatment on offer in the early 20th century. In 1917, malaria therapy was introduced, where a patient would be deliberately infected with the zoonotic disease to induce fever to fight neurosyphilis. In 1920, the barbiturate-induced deep sleep therapy for premature dementia, aka precocious madness, or in its modern name form, schizophrenia. This treatment used drugs to keep patients unconscious for days or even weeks. In 1927, you might have been given insulin